Good evening. The County Commissioners meeting for November the, what day was this is? 18th, 2019 will now come to order, please. I'm not Chairman Jeanette Council, but I'm Vice Chairman Marshall Faircloth, and I welcome you here. And at this time, I would like to call on Commissioner Jimmy Keefe for our invocation and pledge of allegiance. Mr. Keefe.
We all can stand. Dear Lord, bless this time we all come together. Protect us as we do your work. Protect our armed forces, our first responders, and all the people in public service. In your name we pray, amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Keefe. At this time, we'd like to introduce our Cumberland County, or excuse me, our Fayetteville Cumberland County, I'm new at this, youth council members, and if you'll please come up and stand up and introduce yourself and tell just a couple of things about you. Justin?
Hello, sir. My name is Justin Robinson. I attend Cumberland International Early College High School, and I am in the 71st District. I am part of the Fayetteville Cumberland Youth Council, and I serve as the Program/Marketing Executive Board member. Thank you.
Thank you.
Welcome.
Welcome.
Let me try to get a picture.
Okay.
Hello, my name is Jessica Cody. I am a senior at Northwood Temple Academy, which of course is on the north side of town. I am a new member of the Fayetteville Cumberland Youth Council, so as you can imagine, I am very excited to be here.
Welcome, Justin and Jessica. Hope you'll take good notes tonight, because at the end of the meeting, which should be fairly short, but we'll ask you to give us a little critique of ourselves tonight, if you will do that. Thank you very much. At this time, Madam Manager, you have an introduction to make, please.
Yes, sir. Thank you, Mr. Chairman and Commissioners. Good evening. I would like to ask our Assistant County Manager, Mr. Dwayne Holder, who has ended his 21-month tenure as the Interim Health Director today. I think he's probably extremely pleased to introduce Dr. Green, our new Public Health Director.
Time flies when you're having fun. Commissioners, good evening.
Good evening.
I said that in jest, but I truly have been honored to be able to serve as your interim health director for these past 21 months. My only hope is that I have made the county proud to be able to stand in the gap until we found a suitable and appropriate permanent director. And with that, I believe that we have done just that, and on behalf of the Cumberland County Board of Health, and as you know, your chairman, Jeanette Council, serves on that board, and that board underwent a national search for our next leader for public health in this county, and I am pleased to be able to announce and introduce to you, as well as the viewing public, our next public health director in the person of Dr. Jennifer Green. And I'm going to ask if Dr. Green would come and address the board and introduce herself to you as well as the community at this time.
Good evening, Commissioners. How are you doing this evening?
Good evening.
Good. Well, I want to introduce myself and to you and to those members of the public that might be listening in. I'll start with just a little bit of information about myself. I'm a San Antonio, Texas native, so we cheer for the Cowboys, and so I know we're in a different part of the country here. But most recently lived in Manhattan, Kansas, where I served as the director for Riley County Health Department, as their health department director and as their local health officer. So let me give you a little bit of history just briefly about kind of my background in public health. As I mentioned, I served as the health department director there, but prior to that, I sort of wore my academic public health hat and worked for the University of Oklahoma in Oklahoma City on an evaluation project, doing a kind of the more academic academic side of public health. And then before that, I worked for a nonprofit in the state of Texas working on teen pregnancy prevention. So a lot of the issues that are challenging to Cumberland County, I've had experience with. And while Manhattan is definitely a different place in comparison to Cumberland County, in many ways it's similar. Manhattan was a military town, it was a college town, and of course we have very similar public health department programs as you do here. So I'm excited to be here, excited to learn about this community. I think you'll find that I have a very engaging personality and looking forward to meeting with community members, different departments in the community, and then that I'm communicative and transparent to the best of my ability. And I really look forward to being here and working with each one of you. So thank you for having me.
Thank you.
Thank you.
Dr. Green, thank you so much for coming. Your presence is long awaited, and we hope you'll be here a long time, and we look forward to your tenure.
Thank you so much.
This time, we'll have our public comment period, and our manager will read our rules for public comment.
Thank you, Mr. Chairman. The public comment period is an opportunity for the Board of Commissioners to hear the concerns of citizens. The public comment period shall last no longer than 15 minutes. Each speaker will be given a maximum of 3 minutes to make their remarks. No time may be yielded to another speaker. Each speaker will be asked as they approach the lectern to please give their full name and their address. Thank you.
Madam Clerk, do we have any speakers tonight?
This evening, we have 5 speakers. Our first speaker is Henry Eisenberg.
Good evening, Commissioners. My name is Henry Eisenbarth. I live at 786 Ashfield Drive, and I'm here with Mo, and she's going to be our speaker. So, Miss Mo. Oh. Looks like we're dancing.
Good evening, Commissioners. My name is Shadonna Mo McFall, and I live at 2287 Ridge Manor Drive. And I'm here to invite you all to be a part of our Rotary Christmas Parade that will be taking place December the 14th at 11 o'clock right here on Hay Street. This year's parade is sponsored by the Rotary Club, the Liberty Point Rotary Club, the Fayetteville Rotary Club, and the Eve Rotary Club of the Carolinas. Does anybody have any questions? And I hope to see you there.
Any questions for our Rotary Club members?
Oh, Commissioner, Mr. Chairman, I know the Rotary Club has been doing this for a number of years, and they picked this up, and it's a fine event. I know you and I and some others have participated in it. Yeah. I would ask that it not rain this year if you could. It gets a little miserable when it's raining.
That is beyond our ability.
Well, thank you for everything you're doing for the community.
It's an honor. Our theme this year, and it's appropriate with the Youth Council here, is youth leadership. So we're hoping to get leaders through academics, those in sports, and those in service organizations. And they will be our grand marshals this year as well. So it's a small town, small county parade, but it's a good one. And we'd appreciate it if you all would come out and lend your support. Thank you.
Thank you.
Thank y'all for what you do, and some of us will be out there. And
Excellent.
We're looking forward to it.
If you need an umbrella, I'll have one.
Thank you for your time.
Our third speaker is Miss Elizabeth Ramos.
Good evening.
Good evening.
My name is Elizabeth Ramos, and I reside at 1810 Bryn Mawr Drive in Fayetteville, North Carolina. Thank you for this opportunity to come before you and share from my heart a topic that's very near and dear to many of us, and that is our obligation to the least, the last, and the lost of our fellow citizens. Specifically, I'd like to address the issue of those who are suffering from the disease of substance use disorder. As a duly licensed clinical addiction specialist and social worker, I have had the privilege of working with this population for over 30 years here in Cumberland County. The stories I've heard from these men and women have been both heartwarming and heartbreaking. It's probably safe to say that no one in this room has not known or known of someone who suffers from this disease. These people are not disposable because they aren't currently working and paying taxes. Most of them were at time productive citizens. They can and want to be again. So what, as their elected employees, are you willing to do about this situation? Yes, I said employees. Elected officials from the president on down work for we the people, not the other way around. Over the 37 years I've lived in Cumberland County, I have seen many wonderful programs and actions initiated for all citizens. Thank you for your part in that. Right now, you have another opportunity to do the next right thing for the people in your county who need some help. For 58 years, my Rover Reese Fellowship Homes have been helping men and women who suffer from the disease of substance use disorder by providing them with safe, clean homes and access to treatment. One facility, My Rover Reese, addresses both issues of homelessness and substance use disorders. But recent decisions made by Alliance, Cape Fear Valley Medical Center, and politicians have jeopardized the very existence of this nonprofit humanitarian organization. I serve on their board of directors, and I've seen miracles of changed lives and the deterioration of the support from our leaders. Our main source of referrals for admission came from Roxy Avenue Center, which, as y'all know, is now closed. Even when opened, it was licensed for only 16 beds to support a community of over 300,000. And now Recovery International has purchased what was Roxy Avenue, and they are not nonprofit. Their focus is on medication-assisted treatment, or MAT, basically using methadone or Suboxone for people with opioid addiction. MAT has a place in treatment, but our citizens should have a choice. It's no surprise to me that there are 4 and soon to be 5 clinics in Fayetteville that are money-making businesses. And how many nonprofits, halfway houses, does our government support? None. I'm asking for your help to change this. Thank you very much.
Thank you, ma'am. Thank you.
Our next speaker is Mr. Bill Fry.
My name is Bill Fry. I live at 610 Wilkes Road in Fayetteville, North Carolina. I appreciate you letting me speak tonight. I just wanted to say this to follow up on what Elizabeth said. In the late 80s, the late Senator Joe Rayner and Pat Reese, who some of you know, went to the legislature and passed legislature back then, which would later be called the nickel a bottle tax, which meant that for every bottle of liquor sold in North Carolina, a nickel a bottle would go to rehabilitation. That relieved the burden on taxpayers to pay for rehabilitation of alcoholics. It was a great system. Money went to mental health paid for beds for rehabilitation. Well, somewhere down the line, along came Mental Health Reform and Alliance. The county commissioners did the county a great disservice. Not only did they not follow the law that says that tax money must stay in Cumberland County from the ABC board, they gave the money to Alliance, whose office is in Durham. Alliance gives none of that ABC money back to Cumberland County. Now, if that is not wrong, I don't know where you all are sitting. That money needs to come back to Cumberland County where it belongs, because it's Cumberland County taxpayers that are paying that money. Not Durham, not Wake County, and not Johnston County. That money needs to come back to Cumberland County and needs to go back to where it belongs, paying for rehabilitation beds. Thank you.
Thank you.
Our last speaker is Ms. Charmaine Tober.
Good evening, gentlemen.
Good
My name
evening.
is Charmin Tober, and currently I'm homeless. I'm living on the streets, but I have a P.O. box. But anyways, I'm here to talk. Thank you. I'm here to talk about the homeless situation in Fayetteville. What you all have been doing is the city has been is discussing it with you, and you've called it off and everything. We need many homes in this county. I've been preaching this for almost 6 years, and I've talked to other people about it. Some don't want it, some do. But I think if we can get it where it's most plausible for everybody, people who can pay for this, people who live in these homes can actually pay for their own homes, and they can make it, well, my plan is laid out. I have a community center. I have a chapel. They say there's no chapels that they can go to at nighttime if they want to go in and pray. And they've came to me. They call me Mom on the streets. Many of them know me. I help them out the best I can, when I can. And they know me out here. And they said, I have no place to pray. And I said, well, we'll work on that. And they want, I think, a self-sufficient place would be, like I said, I have men, women, seniors, and families. And these would be rows of many homes. And in the background would be a community center. And on the side would be an auto mechanic place and a wood workshop. Over here would be a chapel. And over here would be a garden and a chicken coop and a playground for the children next to where they're staying. But this needs to go somewhere in the community. The city is talking about a daycare center. Well, we don't need just a daycare center. We need a center for all the time, like inclement weather, like the cold, like the freezing. I don't know if you heard about it, but 2 men died in New York City. They froze to death yesterday, and it was near Trump Towers, and now they're trying to blame it on Trump. Well, this is what happens when people are out here don't have enough covers and clothes and are not able to take care of themselves. We do have alcoholics out here that I know of. A couple of years ago, I had to call an ambulance on a guy. He had hypothermia. He'd been drinking, and he went to lay down, and then he couldn't move. But this is one case out of many. And, there's a lot of alcoholics, there's a lot of drug addiction out here. They need therapy, they need counseling, but they need, most of all, a place to stay and to work and to have some self-worth. Now, that's my plan, and that's what I think you all need to look into as concerned citizens, as Christians, as people helping other people, whatever you want to call it. I mean, it's out there. It needs to be attended to. I mean, if people want to hear about my plan, I had it on paper, but I didn't bring it with me tonight. So, anybody have any questions? Thank you.
When you get that plan, get it to our clerk. I'd love to see it.
Okay.
Anyone speak?
There are no further speakers.
Okay, this concludes the public comment period. This time, I'd like to recognize our Arts Council Director. Please stand up and just say hello. Thank you, Greg. And at this time, are there any members of the very many boards and commissions that we appoint? Are there any members present tonight? Okay. Thank you. At this time, we'll move on into our regular business meeting, and I'd like to call on Ms. Cannon for agenda approval.
Yes, sir. Item number 1 is approval of the agenda, and we have no changes this evening.
Okay, do I hear a motion to approve the agenda?
So moved.
Is there a second?
Second.
Okay, it's been moved and seconded. Any discussion?
Can I ask a question? Just one question right quick. On items number 4, A and B, which we did in the agenda setting conference, could those not be moved to the consent agenda and be done?
Actually, I'm not sure that item A was on the, from the agenda session, and item B specifically for bond counsel purposes
Okay.
has to be a separate item.
Okay, I thought those were. All right. I'm
Okay.
good.
Any other discussion? Not all in favor?
Unanimous.
Okay, Ms. Cannon.
Yes, sir. Item number 2 is the consent agenda.
Anything to be pulled or anything from the consent agenda?
Move to approve the consent agenda.
Okay. Moved and seconded. Any discussion? All in favor?
Unanimous.
Okay, Ms. Cannon.
Item number 4 are items of business. Item 4A is our Homeland Security Grant Program Award from the North Carolina Department of Public Safety. We have an associated budget ordinance amendment. I'll ask our Emergency Services Director, Mr. Booth, to present this item.
Welcome, Mr. Gene Booth.
Good evening, Chair and Commissioners. Hope you're doing well. So I'm honored to bring before you Emergency Services received notification that were eligible and were selected for a grant through the 2019 Homeland Security Grant Program in the amount of $64,307. The grant award is from the Domestic Preparedness Region, we call it the DIPR. The grant will be used to purchase an all-terrain vehicle that will be utilized as an EMS MedStat vehicle. And to kind of paint the picture, we're looking at an ATV four-wheeler with an ambulance box on the back. The vehicle will be used through Cape Fear Valley Health Systems to respond to medical emergencies, off-road, and during local festivals. Cumberland County encompasses many rural areas which many ATV enthusiasts utilize, including a 2,500-acre ATV park that's currently in operation in Linden. In addition, with the revitalization of the downtown and the many festivals that are held downtown, games and other events, the frequent use of an ATV is needed for coverage. It allows them to maneuver the streets and maneuver the crowds much more effectively. The ATV ambulance will be a mini ambulance with a covered patient compartment box that will add for patient and personnel safety while treating patients and in austere and congested areas. In addition, the EMS MedStat vehicle will be available if needed by the 10 counties that make up the domestic preparedness region that Cumberland County falls in. Staff recommends approval of the budget ordinance amendment B201060 to recognize the grant funds in the amount of $64,307, to recognize a grant award and acceptance of the grant award from North Carolina Department of Safety Homeland Security Grant Program to purchase the EMS MedStat all-terrain vehicle. If you have any questions, I'm here to.
Any questions for our emergency director? Jimmy?
Motion
Commissioner
to-
Keefe, I'm sorry.
Motion to approve.
Okay.
Second.
Moved and seconded. Any discussion? All in favor?
Unanimous.
Okay, Ms. Cannon.
Item 4B is a reimbursement resolution for the Fayetteville Technical Community College Fire Training Facility Project. Our Finance Director, Mrs. Evans.
Good evening, Commissioners. This evening, I'm requesting approval of a reimbursement resolution for the FTCC Fire Training Facility Project in an amount not to exceed $10 million. $10 million was the amount the Board of Commissioners previously prioritized within the Governmental Capital Investment Fund of the total estimated $20 million project. The approved resolution will satisfy federal reimbursement requirements by declaring the county's intent to finance a portion of the FTCC Fire Training Facility Capital Project from an installment contract in an amount not to exceed $10 million. Do you have any questions?
Any questions for Finance Officer? Mr. Keefe, sorry.
Mr. Chair, I'd like to make a motion to approve that.
Is there a second?
Second.
Moved and seconded to approve the budget amendment. Is there any discussion? All in favor?
Unanimous. Item
Thank you.
5 are the nominations.
Okay. Are there any nominations?
Mr. oh,
Yeah.
I just have one for the, I think we're on the Cumberland County Workforce Development. As you remember, I talked to Ms. Rush this year, and she's asked Nora Armstrong as for that position.
Okay, we have Norma Armstrong for one nomination. We do have 2 vacancies. Is there another nomination?
How about the Charlene? Is that part of that
She's not eligible.
completed? So we have,
Yeah, we don't
so
have.
we
an
have the
eligible.
one.
Yeah, we just have the one. Okay. Okay, we'll accept the one nomination and we'll defer the next nomination to the next meeting. Okay, item 5B, I'd like to call on Mr. Glenn Adams.
For 5B for the senior citizens, I just had that up.
Mid-Carolinas.
Oh, Mid-Carolinas, you skipped Mid-Carolinas, that's why I couldn't do that.
I'm sorry. I got you the wrong one, didn't I? Okay. We need a nomination, I'm sorry, for 5B. It's Mid-Carolina Agency, Aging Agency. Do we have a nomination? The electronics are running slow tonight. Okay, at this time, I would nominate Eleanor Hare, who is the agent council's recommendation. And that's our, that's one vacancy that we have. And I'm sorry now, Mr. Adams, 6A, please.
There is one appointment, for the appointment, I'd ask that that be approved with Honeycutt.
Okay, is there a second?
Second.
It's moved and seconded for the approval of Ms. Honeycutt. Any discussion? All in favor?
Unanimous.
Okay. Ms. Cannon.
The next item is a closed session, and we are not needing a closed session this evening.
Okay, no closed session is needed. Do I hear a motion to adjourn?
Well, you got your, youth council.
Oh, I'm sorry.
That's okay.
It says right there, call the FCCYC members to the podium to input on what they learned or gained from attending the meeting. I told you to be short.
Better come back next time.
I told you to be short.
Extend their assignment.
Justin and Jessica, come tell us what you learned tonight. And we will definitely have you back again.
So today, I learned about the Rotary Christmas Club. It's trying to install a youth leadership program. Congratulations to the new health director for earning the position, and thank you for the previous health director. Disease awareness for substance use disorder, and a plea for organizations to band together to help stop it. Also, creating a center for the homeless community in order to prevent hyperthermia and also provide therapy for substance use disorder. And the implementation of an ATV ambulance to help navigate throughout more crowds. Thank you.
You looking for a job, son?
Outstanding.
I try. I try sometimes.
You can come back anytime you want to. How about coming up here and taking this seat right here? Great job.
That's a good job thinking on your feet, young man. Jessica, you got anything to add to that? No?
I don't blame you.
But we gotta get our picture though.
Thank you guys for being here, and we'd like to get a picture with you if you come up, please.
Get rid of Mr. Bruce's chair. Pretty thorough. Well, I'll be really in the picture.
This is best we're gonna look all week now, so y'all.
What happened to the high picture that Jeffrey did?
Thank you.
Usually they're a little bit longer than this.
Let's say, like, thank you. City council.
Do we have to adjourn again?
I heard a motion, but I didn't hear a second. Was there a second to the motion to adjourn?
I'll second the motion.
Okay, all in favor?
Yeah.
Okay, unanimous.
It's your big day.